What role does the placenta play in preeclampsia? Imagine a tiny organ in your womb that acts like a busy delivery station, supplying your growing baby with oxygen and nutrients. That's the placenta. It's essential for a healthy pregnancy. But sometimes it doesn't develop as it should. When that happens, it can cause serious problems like preeclampsia. In a normal pregnancy, the placenta attaches deeply into the wall of the uterus. It helps blood vessels grow wider so enough blood can flow to the baby. This process is called placental implantation. When this process goes wrong, the blood vessels in the placenta stay narrow and don't supply enough blood. This is called abnormal placental development. In preeclampsia, the poorly developed placenta releases substances into the mother's bloodstream. These substances cause her blood vessels to tighten and become less flexible. As a result, her blood pressure rises. This can lead to damage in her organs, especially her kidneys and liver. It can also cause protein to leak into her urine, which is a sign of organ stress. The placenta's improper development is a key factor in preeclampsia. It triggers a chain reaction that affects the mother's entire body. Because the placenta isn't providing enough oxygen and nutrients to the fetus, it can also slow down the baby's growth. Doctors often monitor the placenta closely during pregnancy if preeclampsia is suspected. Understanding the placenta's role helps explain why managing blood pressure is so important. Regular checkups can catch early signs of preeclampsia before it becomes severe. Sometimes, early delivery is the best option to protect both mother and baby. Living with hypertension during pregnancy means keeping a close eye on the health of both mother and fetus. Women with pre-existing high blood pressure are at higher risk for preeclampsia. That's why managing blood pressure and monitoring the placenta are vital parts of prenatal care. After delivery, the placenta is expelled, but blood pressure can still stay high, so ongoing care is often needed. In the end, the health of the placenta is directly linked to the health of the mother and the baby. Proper development and function of this tiny organ are essential for a safe pregnancy. When it doesn't develop right, it can cause preeclampsia, but with careful monitoring and timely action, many complications can be prevented.